Uh, the topic of discussion is dental pulp. So here we will be discussing about anatomy of the pulp, histology of the pulp, functions of the pulp and its development, and age or regressive changes of the pulp. So let's move into anatomy of the pulp. So if you see anatomy of the pulp is basically a mesenchymal connective tissue which occupies the center of the tooth, and it is covered on all sides by rigid dentinal walls. And this pulp chamber, it contains numerous blood vessels and nerves, as you saw in the picture. So basically pulp is a soft connective tissue which is highly vascularized and highly innervated by the nerves, both sensory as well as sympathetic nerves. And if you see the pulp cavity or pulp organ, it is divided into two parts, that is coronal pulp as it is present in the crown, and the radicular pulp which is present in the root. If you see this picture, the whole pulp, it is divided into coronal pulp and radicular pulp. So the coronal pulp, it is present in the crown part which contains a pulp chamber, and the radicular pulp which is seen within the root canal, okay, in the roots. So going on into the coronal pulp, so the extension of this coronal pulp is high into the cusps, which are nothing but pulp horns. So these pulp horns, they go one into each cusp and they are very high in younger age group. As the secondary dentin deposition occurs, the size of the pulp horns also will decrease. And if you see in radicular pulp, each root has one or more root canals, and there are lateral branches which has these canals called as accessory canals or lateral canals. And at the apical end of the root canal, there is an opening called as apical foramen, as you can see in the picture. And through this apical foramen only, our pulp, it communicates with the periapical tissues. Okay, and the diameter of this apical foramen, it varies in each and every tooth. So if you see the average size of this apical foramen, in maxillary teeth it is around 0.4 mm, and in mandibular teeth it is 0.3 mm in diameter. Okay, this is about the anatomy of the pulp. Next is the histology of the pulp, or a structure of the pulp you can say, or if someone asks zones of the pulp, it is the same. If you see basic structure of this pulp, it is mainly of two parts, central region and peripheral region. Central region contains blood vessels and nerves, whereas peripheral region is called as odontogenic zone. Okay, so this odontogenic zone, it contains various zones again, that is odontoblastic zone, cell-free zone of Weil, cell-rich zone and pulp core. So there is a picture here which is showing the odontogenic zone, which is consisting of odontoblast, that is odontoblastic zone, cell-free zone, cell-rich zone and pulp core at the bottom. Okay, these are various zones or histology of the pulp. Now let's see individual zone in detail. Firstly, we will be seeing about odontoblastic zone, which contains high number of odontoblasts. Name itself suggests that it contains odontoblasts. Okay, so this is a picture again of different zones of the pulp, and if you see this odontoblastic zone, which contains various odontoblasts which are aligned side by side in a palisading manner, and they are present adjacent to the unmineralized dentin called as predentin on the top. Okay, and these odontoblasts, they measure around 5 to 7 microns in width and 25 to 40 microns in their height. That is length of the odontoblast is 25 to 40 microns. And if you see the number of odontoblasts within this zone, they are around 59,000 to 76,000 per mm square. So many number of odontoblasts are present. And if we are going on into to discuss about structure of odontoblast cell body is basically columnar in appearance, like you can see here, and contains large oval nuclei and filled with too many cell organelles like mitochondria, Golgi and rough endoplasmic reticulum. So there is an extension of this odontoblastic process which is called odontoblast, which is called as odontoblastic process, which is present inside the dentinal tubule. And these odontoblastic process, it is devoid of other cell organelles but contains microtubules and microfilaments, and these microtubules and microfilaments, they are composed of proteins like tubulin, vimentin and actin. So this is about the structure of odontoblast. And an odontoblast has a life cycle, that is it varies from different areas. So if it is an active cell is nothing but a synthetic cell. That means synthetic cell, it secretes dentin. So how does an active and synthetic cell looks like? It is elongated and how it is shown in the picture, and the nucleus is basally placed and contains various synthetic cell organelles like Golgi complex, rough endoplasmic reticulum, mitochondria, all this. So like this an active cell will look like. And before this active cell goes into resting stage, there is a transitional or intermediate stage. As you can see in the picture, the transitional cell has become a little narrowed down. Okay, the cells are narrowed and has fewer organelles compared to that of an active cell and contains autophagic vacuoles. And as it is going into the resting stage, this resting cell will be flattened and spindle shaped, and it is devoid of all the organelles. That is why it is resting stage odontoblast. So this is about odontoblastic zone. Now we'll move on to the next zone, cell-free zone of Weil. As it is cell-free zone, there are no cells present, it is a clear zone. Okay, and here there are only very few fibers, as you can see those black fibers which are running through this zone. And what is the main basic function of this cell-free zone is that it permits the movement of odontoblasts to move towards inwards the pulp. As the dentin is produced, right, odontoblasts can utilize this space to move inward. So this is about cell-free zone. Next is cell-rich zone. That means too many cells will be there, and the predominant cells which are seen in the cell-rich zone are fibroblasts and undifferentiated mesenchymal cells along with a few fibers. Okay, now let's see about these fibroblasts. So fibroblasts, these are actually the predominant cells in the pulp. So we usually think that odontoblasts are the predominant cells, but that is not correct. Fibroblasts are the predominant cells followed by odontoblasts. Odontoblasts are second predominant cells. So what is the main function of fibroblasts? Fibroblasts produce collagen fibers, and any active fibroblast, it is basically stellate shaped, that is star shaped and like this, and it contains extensive processes, and with these processes only it gets connected with the collagen fibers and the adjoining fibroblasts and all. And as it is an active cell, it contains various synthetic cell organelles. So these stellate shaped fibroblasts are high in number in younger pulp because they are synthetic in nature. As it is going into the older pulp, these fibroblasts, they become rounded or spindle shaped like in the picture, and contains very fewer organelles, and these kind of spindle shaped fibroblasts are called as fibrocytes. And earlier I told you fibroblasts, they help in production of collagen, right? Even for the degradation of collagen also fibroblasts are only needed. So fibroblasts, they help in production and degradation of collagen. Other than this, they also help in inflammation and healing with the help of growth factors, fibroblast growth factor 2 and vascular endothelial growth factor. So these are various functions of fibroblasts. So after fibroblasts, it is undifferentiated mesenchymal cells which are predominant in cell-rich zone. Undifferentiated, that means they just lie down there, whenever need arises they get differentiated. Okay. So these undifferentiated mesenchymal cells, they are larger than fibroblasts and they are polyhedral in shape. Okay, and they are found along the pulp vessels, that is blood vessels. They are many in nature, and they have totipotency. That means they can get differentiated into any other type of the cell based upon the need. So whenever there is a need for collagen fibers, then they will turn into fibroblasts. When there is a need for secondary dentin formation, they differentiate into odontoblasts. Whenever there is a protection needed or defense mechanism needed, they get differentiated into macrophages like this. So this is about undifferentiated mesenchymal cells. I told you along with fibroblasts and undifferentiated mesenchymal cells, we have fibers. So what are the major fibers which are seen in the pulp? That is collagen fibers, and they exhibit cross striations at 64 nanometers, and predominantly we see type 1 and type 3 collagen within the pulp. And this type 1 collagen, it is secreted by odontoblasts, whereas type 3 is secreted by fibroblasts. But what is the main difference between type 1 and type 3 secreted by odontoblasts and fibroblasts? Basically, the collagen deposited by odontoblasts has a tendency to calcify and it can become dentin, whereas the collagen which is deposited by fibroblasts will not undergo calcification. That is the main difference between collagen of odontoblasts and fibroblasts. So this is about cell rich zone. Now we'll move on to pulp core. So pulp core, it predominantly contains fibrous tissue along with major blood vessels, nerves and fibroblasts. As we have discussed about fibers and fibroblasts, now we'll see about blood vessels and nerves. So we'll see about blood vessels within the pulp. So as we know, pulp itself is a highly vascularized region, and what are these main blood vessels they are coming from? So they arise from inferior or superior alveolar artery and also drain by the same veins, inferior and superior alveolar veins, in both maxillary and mandibular regions. So like as you can see in this picture, these blood vessels, they enter through the apical foramen along with the nerves, and they enter through the root canal and move into the pulp chamber. So as they move, they undergo extensive capillarization, as you can see here, lateral branching. So the arterial supply first, as it enters the apical foramen, it divides into finer branches like arterioles, capillaries, like that. Once they become capillaries, they move into the odontoblastic zone and then lie between odontoblast and then reach towards the predentin. So from bottom to predentin, they start to move and undergoes lateral branching. So like that it gives blood supply. So along with the arteries, these arteries, they also form anastomosis with the veins. So this kind of anastomosis, as you can see here, is arteriovenous or venous-venous communication or anastomosis. So it forms a U-turn looping or a hairpin looping of the vessels within the pulp. So this is about blood supply to the pulp. Then going on into the nerves or innervation of the pulp, which is both by sensory as well as sympathetic. So if you see in this picture, same like blood vessels, even the nerves, they enter through the apical foramen, okay, and they ascend in the coronal direction into the pulp chamber. So if you see this picture, so the as they give rise to branches, I said, right? So they give out extensive branches nearer to the cell rich zone. These extensive branches are called as parietal layer of nerves or plexus of Rashko. Okay, so these plexus, they contain large myelinated A delta fibers and small unmyelinated C fibers. So these myelinated and unmyelinated C fibers, they lose their myelin sheath as they move into the cell rich zone. So when they are losing their myelin sheath, they become free nerve fibers. So once they become free nerve endings or free nerve fibers near the cell free zone, they get this special sensation of pain. So that is when these free nerve terminals from here, they enter into the odontoblastic layer and penetrate into the predentin zone or inner dentin, and they help in innervation. That is how we feel the sensation of pain. So this is about nerve supply. Next, those are the zones of pulp, and now we'll move into the next topic, functions of pulp. There are various functions of pulp which are categorized into 5 types. First is inductive. As pulp, it is derived from dental papilla cells through epithelial mesenchymal interactions. So as a part of the reciprocal induction, the dental papilla cells, they have a tendency to induce the inner enamel epithelial cells to become ameloblasts and then produce enamel. So that is an inductive phenomenon. So it is an inductive property. Next is formative function. So the pulp contains cells which form dentin. Okay, that is, what are the cells which form dentin? That is odontoblasts. Okay, so that's how it can help in the formation of some organic matrix for dentin and also helps in its calcification. Next is nutritive function. As pulp is highly vascular, it takes up this it takes up the nutrients along the blood vessels to the odontoblasts. So like that it helps as a nutritive function. Next is protective function. So pulp also is sensory in nature. So pulp, it responds to various thermal, chemical as well as physical stimuli. So how it responds? It responds in the form of pain. So it responds in the form of pain and protects the tooth from the injury basically. So this way it is protective in nature. Next is defensive or reparative. As we know, pulp has undifferentiated mesenchymal cells, right? So whenever need arises, they can differentiate into odontoblasts. So whenever, depending upon the stimuli, like a low stimuli or high stimulus, it helps in formation of tertiary dentin, that is either reparative or reactionary dentin. So as according to the stimulus. So how is it formed? By producing odontoblasts only. So like that it helps in defensive or reparative function. So next is development of pulp. How does a pulp develops? So usually the initiation of pulp development, that is initiation of development of pulp, it starts around 8th week of intrauterine life. That too it starts from deciduous incisor and then proceeds towards the our permanent teeth. So if you see during Bell stage, the dental papilla will become highly vascular. So when the dental papilla becomes highly vascular, what it does is like it initiates it stimulates the inner enamel epithelial cells which are present above it, inner enamel epithelial cells, to become ameloblasts. Once this induction is happened, these ameloblasts, they start to stimulate the underlying dental papilla cells to become odontoblasts. As odontoblasts are developed, they start to secrete the dentin matrix. So once first layer of dentin is formed, the dental papilla is now designated as pulp organ. So the peripheral layer of dental papilla cells, they turn into odontoblasts and secrete dentin, and the remaining dental papilla cells, now they become pulp. So pulp contains various things, right, like undifferentiated mesenchymal cells, fibroblasts, vascularity, nerve supply. So once the remaining dentinal cells, they become pulp, the undifferentiated mesenchymal cells of the pulp, they start to differentiate into stellate shaped fibroblasts. So as the fibroblasts are developed, it starts to produce this collagen fiber matrix also. So after this, slowly the vascularization also starts to increase. That too in the form of the vascularity, the blood vessels, main blood vessels, they start to branch out and give rise to venules, arterioles and capillaries, and they extend till the odontoblastic layer. As the blood supply comes, even the nerve supply also comes, and the nerves, they are seen from the earliest stage itself, and the main nerves which enters the pulp at the beginning are the sensory nerve supply, followed later by the sympathetic ones. Like this pulp will develop. So this is about the development of pulp. Next, moving on to age changes of the pulp. So first and foremost and important one is pulp stones. Pulp stones are nothing but they are also called as denticles. So stones, that means some calcified structures which are seen in coronal or radicular pulp. Mainly coronal pulp we will see. And these pulp stones are of two types, true pulp stones and false pulp stones. So what are true pulp stones? These are the calcified structures which contain dentinal tubules, like dentin. Okay. So here, as you can see in this picture, this is a pulp stone which contains, those lines are nothing but dentinal tubules. Whereas false pulp stones, they usually appear, they are calcium deposits which are arranged in concentric layers. So how does this true denticles form? So true denticles, they are formed by Hertwig's epithelial root sheath, that is remnants of Hertwig's epithelial root sheath which induce the dental papilla cells to produce dentin. Whereas false pulp stones, they appear in concentric layers and they are formed around blood vessels, collagen and necrotic tissues. That is, they begin to form around the nidus, and then first it will be small and they start to become big by concentric layers. So this is broad category, that is true and false, but there are in according to the relationship with the dentin, there are three types of pulp stones: free, attached and embedded. If you see free pulp stones, they lie freely within the pulp chamber without any attachment, so they are entirely surrounded by only pulp tissue alone. Okay, if at all there is secondary dentin formation which forms and these pulp stones, they get attached to this dentinal wall, then they are called as attached pulp stones, that is partially fused with the dentin. And if the dentin formation, if it continues and leading to embedment of these pulp stones within the dentin, then they are called as embedded pulp stones, that is pulp stones, they are entirely surrounded by dentin. So other than these, there are some other age changes, like size of the root canal. What happens as age increases? As age increases, size of the root canal also decreases. Why? Because there will be continued secondary dentin formation, which results in narrowing down of the pulp chamber. Next, what happens to vascularity? As there will be decreased, as the size of the root canal also decreases, there will be complete obliteration of the root canal as the age increases, and as such vascularity also will be decreased. And then there will be cellular changes also. That means population of the cell, that is our undifferentiated mesenchymal cells, fibroblasts, they will decrease in number, as well as cellular organelles within each cell also will be decreased. Next, what happens to the collagen fibers? So as I said, decrease in the number of cells. Okay, so like here collagen fibers, they get, that is the fibers of the pulp, they get arranged in bundles as age advances. So these bundles, they result in fibrosis. So this fibrosis, it occurs around capillaries, blood vessels, and around all areas as the age advances. And next is there is decreased innervation. That means because there will be degeneration of both myelinated and unmyelinated nerves. So as degeneration occurs, there will be decreased innervation. So because of which there will be decreased sensitivity, which is seen in case of older people. So this is about in detail about pulp. And as you can see, like in this pulp, like zones of pulp, that is histology of the pulp, functions of the pulp, and age changes. These are very important topic in exam point of view, so please concentrate on those topics more.